8 Lung Cancer Symptoms on Skin. When to consult a doctor. Welcome to today's video, where we're exploring something that may surprise you: how lung cancer can reveal itself through your skin. When most people think of lung cancer, they imagine coughing, chest pain, or shortness of breath. But in some cases, the earliest warning signs can appear on the skin. Lung cancer is one of the leading causes of cancer-related deaths worldwide, largely because it's often diagnosed at a late stage. While it's commonly linked to breathing problems, your skin can provide important clues about what's happening inside your body, sometimes before lung symptoms even begin. These skin changes aren't random. They usually occur through 3 key mechanisms: direct spread of cancer cells to the skin, paraneoplastic syndromes where tumors trigger immune or hormonal reactions, and widespread effects the cancer has on the body. Recognizing these connections can be life-saving. Today, we're covering 8 specific skin symptoms linked to lung cancer. Each one has unique characteristics that you can learn to recognize. We'll discuss what they look like, why they happen, and most importantly, when you need to see a doctor immediately. Some of these signs might appear months before any breathing problems develop. Others signal that cancer has already spread. Either way, knowing what to watch for gives you a critical advantage in catching this disease early. Whether you're a smoker, have a family history of cancer, or simply want to be informed, this information is vital. Let's dive into these 8 skin symptoms that could indicate lung cancer. Disclaimer: this content is for informational purposes only and is not intended as medical advice, diagnosis, or treatment. Always consult a qualified healthcare professional if you notice unusual or persistent symptoms, or if you have concerns about your health. Do not ignore professional medical advice or delay seeking care based on information found here. All information presented has been thoroughly researched and verified. You can find source links in the video description. 1. Dermatomyositis. Dermatomyositis presents with distinctive skin changes that doctors can often recognize immediately. The most characteristic sign is the heliotrope rash, a purple-red discoloration around your eyelids that often includes swelling. This isn't your typical under-eye puffiness from a bad night's sleep. The second telltale sign is Gottron papules. These appear as scaly, purple-red bumps over your knuckles, elbows, knees, and ankles. They're raised and rough to the touch, often mistaken for eczema or psoriasis at first glance. But dermatomyositis isn't just about skin. The myositis part means muscle inflammation, causing weakness in your shoulders and hips. You might struggle climbing stairs, lifting objects overhead, or even rising from a chair. Here's why this matters for lung cancer. In adults over 50, dermatomyositis is strongly associated with internal malignancies. Studies show up to 15% of cases linked to cancer, with lung adenocarcinoma and small cell lung cancer being primary culprits. The mechanism involves tumor cells expressing abnormal proteins, particularly TIF1 gamma antigens. Your immune system recognizes these as threats and produces antibodies. Unfortunately, these antibodies also attack your own muscle and skin tissues, a case of mistaken identity with serious consequences. The rash may appear months before any cancer diagnosis. It can also develop alongside the cancer or even after treatment begins. Blood tests showing elevated muscle enzymes combined with specific autoantibodies help confirm the diagnosis. If you're over 50 and develop these purple rashes with muscle weakness, don't wait. This combination demands immediate medical evaluation and comprehensive cancer screening. 792. 2. Acanthosis nigricans, the velvety darkness. Acanthosis nigricans creates dark, velvety patches that feel thicker than surrounding skin. These typically appear in body folds, your armpits, groin, neck creases, and sometimes spreading to your face. The affected skin feels soft but noticeably textured, like velvet fabric. Most cases of acanthosis nigricans relate to obesity or diabetes. However, malignant acanthosis nigricans behaves very differently. It appears suddenly in adults without metabolic issues, spreads rapidly over weeks to months, and often comes with intense itching. Watch for tripe palms, a related condition where your palms become thick and ridged, resembling the texture of stomach lining. When tripe palms occur with acanthosis nigricans, the likelihood of underlying cancer increases dramatically. Lung tumors cause this through biochemical warfare. They secrete transforming growth factor alpha and insulin-like growth factor 1. These molecules flood your bloodstream, reaching skin cells and triggering explosive growth of the outermost layer. The connection to lung cancer is less common than with stomach cancer, but it's well documented in both non-small cell and small cell lung cancers. The key distinguishing features are rapid onset, mucous membrane involvement, and accompanying pruritus in someone without diabetes. If you notice sudden darkening of skin folds, especially with palm changes or mouth involvement, this warrants urgent evaluation. Standard skin lightening treatments won't work because the problem originates internally. The good news? These lesions typically fade when the underlying cancer is successfully treated. The bad news? Their presence often indicates advanced disease requiring aggressive intervention. 3. Cutaneous metastases. When cancer reaches the skin. Cutaneous metastases represent cancer that has physically traveled to your skin. These appear as firm nodules, small, raised bumps that feel solid when you press them. They're usually painless initially and can range from flesh-colored to red, purple, or even bluish-black. Unlike benign skin growths that develop slowly, these nodules often appear relatively quickly. They can occur singly or in clusters. Common locations include the chest wall, abdomen, head, neck, and scalp, though they can emerge anywhere. As they grow, these lesions may ulcerate and bleed. Some become inflamed and tender. Others remain asymptomatic until they reach considerable size. Their appearance can mimic benign cysts or lipomas, making clinical diagnosis challenging without biopsy. The mechanism is straightforward but ominous. Cancer cells break away from the lung tumor, travel through blood vessels or lymphatic channels, and establish new colonies in skin tissue. Finding cancer in your skin means it has metastasized, indicating stage 4 disease. Cutaneous metastases occur in 1 to 12% of lung cancer patients. They're more common in men and typically signal widespread disease. When present, median survival drops to 3 to 6 months without treatment. Diagnosis requires skin biopsy with special staining. Immunohistochemistry tests for thyroid transcription factor 1 and cytokeratin markers help confirm lung origin. Imaging studies then identify the primary tumor and other metastatic sites. If you develop new, firm skin nodules, especially on your chest or scalp, and you have risk factors for lung cancer, don't assume they're harmless. Early biopsy can lead to diagnosis and treatment before symptoms become severe. For jaundice, jaundice turns your skin and the whites of your eyes distinctly yellow. This isn't subtle. It's a dramatic color change that others will notice before you do. The yellowing results from bilirubin accumulation, a yellow pigment produced when red blood cells break down. Accompanying symptoms tell the complete story. Your urine becomes dark, like tea or cola. Your stools turn pale or clay-colored. Intense itching often develops, sometimes becoming unbearable. You might experience right upper abdominal pain where your liver sits. In lung cancer, jaundice signals metastatic spread to the liver or obstruction of bile ducts. Cancer cells invading liver tissue disrupt normal bile flow. Alternatively, tumors can compress bile ducts mechanically, preventing bile from reaching your intestines. This is particularly common in small cell lung cancer and advanced non-small cell varieties. The liver is a frequent metastatic site because blood from the lungs flows directly there. When enough liver tissue becomes replaced by cancer, jaundice develops. Blood tests show elevated bilirubin, alkaline phosphatase, and liver enzymes. Imaging with ultrasound, CT, or MRI reveals liver metastases or bile duct obstruction. Sometimes ERCP, endoscopic examination of bile ducts, becomes necessary. The prognosis with jaundice is serious. It indicates advanced disease with significant liver involvement. However, interventions like biliary stents can relieve obstruction, improving quality of life and allowing treatment to proceed. If you notice yellowing skin or eyes, dark urine, or pale stools, seek medical attention immediately. This represents a medical emergency requiring rapid evaluation and intervention, particularly with any history of smoking or lung problems. 5. Pruritus. Pruritus means itching, but not ordinary, occasional itching. Cancer-related pruritus is persistent, severe, and resistant to standard treatments like antihistamines or moisturizers. It can be generalized across your entire body or localized to specific areas. The constant scratching creates secondary problems. Excoriations, scratch marks, and broken skin appear across affected areas. Bruising develops from aggressive rubbing. Over time, your skin may become thickened, darkened, or scarred from chronic trauma. Several mechanisms drive this symptom. When lung cancer spreads to the liver, bile salt accumulation triggers itch receptors through farnesoid X receptor activation. This increases interleukin-31 production, a powerful itch-inducing molecule. Lung tumors also directly secrete cytokines that activate sensory neurons in your skin. Lysophosphatidic acid and autotaxin produced by cancer cells stimulate itch pathways. Additionally, disrupted opioid signaling in cancer patients can manifest as pruritus. While pruritus is classically associated with blood cancers, it definitely occurs with lung cancer, especially when liver metastases exist. Chronic unexplained itching may even precede other cancer symptoms by months. Diagnosis involves ruling out common causes like dry skin, allergies, kidney disease, or thyroid problems. If basic testing is negative and itching persists despite treatment, cancer screening becomes appropriate, particularly with risk factors present. Treatment targets the underlying cause. Managing the cancer itself often improves itching. Supportive measures include specific antipruritic medications, phototherapy, and newer agents targeting itch pathways. Don't dismiss persistent, unexplained itching as merely annoying. If standard treatments fail and you have lung cancer risk factors, discuss comprehensive evaluation with your physician. 6. Cushing syndrome, the easy bruising. Cushing syndrome from lung cancer creates unmistakable changes. Your skin bruises from the slightest bump. Touching a doorframe leaves purple marks. The skin itself becomes paper-thin and translucent, almost fragile. Blood vessels show through clearly. Wide purple stretch marks appear on your abdomen, thighs, and arms. These aren't pregnancy striae. They're deeper purple or red and much wider. Your face becomes round, red, and puffy, called moon facies. A fat pad develops between your shoulder blades. Small cell lung cancer causes this by producing adrenocorticotropic hormone ectopically. This hormone normally comes from your pituitary gland, regulating cortisol production. Cancer cells hijack this system, flooding your body with ACTH and driving excessive cortisol release. High cortisol levels devastate connective tissue. Collagen synthesis stops, robbing skin of structural support. Capillaries become fragile and leak easily, causing spontaneous bruising. Wound healing slows dramatically. Fat redistributes to your face, neck, and trunk while limbs become thin. Additional symptoms include severe muscle weakness, making standing from a seated position difficult. Hypertension develops quickly. Blood sugar rises, sometimes causing diabetes. Potassium levels plummet, causing dangerous heart rhythms. Psychiatric symptoms like depression or psychosis may occur. Diagnosis requires blood and urine cortisol measurements, ACTH levels, and dexamethasone suppression testing. Imaging identifies the lung tumor. This represents a medical emergency because complications can be fatal without treatment. If you develop sudden easy bruising with facial rounding and muscle weakness, especially with smoking history, immediate medical evaluation is critical. Cushing syndrome from lung cancer carries poor prognosis but requires urgent intervention to prevent life-threatening complications. 7. Horner syndrome, the asymmetric face. Horner syndrome creates a striking asymmetry. One eyelid droops noticeably lower than the other. This is ptosis. The pupil on that same side stays constricted, remaining smaller than its partner even in dim light. This is miosis. The affected side of your face stops sweating entirely, anhidrosis. Touch your forehead during exercise or heat, and one side stays completely dry while the other sweats normally. Some people experience facial flushing or redness on the affected side. The eyeball may appear slightly sunken, enophthalmos, though this is subtle. If you experience shoulder or arm pain with these symptoms, the brachial plexus nerves are likely involved. This combination strongly suggests Pancoast tumor. Pancoast tumors develop at the lung apex, the very top of your lung near the collarbone. As they grow, they invade or compress the sympathetic nerve chain that runs alongside your spine. These nerves control your pupil size, eyelid position, and facial sweating. Disrupting this sympathetic pathway at the C8, T1, or T2 levels produces the classic Horner syndrome triad. Superior vena cava compression from the tumor can also contribute to facial symptoms. These tumors are typically non-small cell lung cancers, though small cell varieties occur. This syndrome is a neurological emergency. New-onset unilateral facial changes in adults demand immediate imaging. Chest CT or MRI will reveal the apical mass. Ophthalmologic and neurologic examinations confirm the diagnosis. If you notice one eyelid drooping with a smaller pupil on that side, especially with shoulder pain, this is not a stroke, but potentially lung cancer. Immediate medical attention is essential for diagnosis and treatment planning. 8. Erythema gyratorum repens, the wood grain rash. Erythema gyratorum repens is rare but unmistakable. Imagine concentric rings of redness spreading across your trunk like wood grain or zebra stripes. These bands move rapidly, up to 1 centimeter daily, creating a shifting pattern that's almost hypnotic. The rings have a trailing scale along their edges, like a wake behind the advancing border. The overall pattern resembles tree rings or topographic maps. It typically affects your trunk and upper arms and legs while sparing hands, feet, and face. Intense itching accompanies the rash. This pruritus can be debilitating, disrupting sleep and daily activities. The combination of bizarre appearance and severe itching usually prompts rapid medical consultation. This represents a paraneoplastic phenomenon where tumor antigens trigger antibody production targeting skin proteins. Immune complex deposition at the dermal-epidermal junction causes inflammation. Interleukin-5 and eosinophil activation perpetuate the reaction. The lung cancer connection is powerful. 32 to 47% of erythema gyratorum repens cases associate with malignancy, and lung cancer leads the list. The rash often precedes cancer diagnosis by several months, making it a potential early warning system. Diagnosis is primarily clinical because the distinctive pattern is pathognomonic, meaning it essentially proves the diagnosis. Skin biopsy shows nonspecific inflammation. Direct immunofluorescence may reveal IgG and C3 deposition. Any adult developing this characteristic wood grain rash requires comprehensive malignancy workup immediately. The rash typically resolves with successful cancer treatment, but may recur if cancer returns. If you notice rapidly spreading concentric rings on your skin with intense itching, don't delay seeking medical care. This is one of the most specific paraneoplastic signs pointing directly to internal cancer. Subscribe to the Human Health YouTube channel for more insights. If you found this content helpful, please like, share, and comment below.